Good day, I am Shamel B. Tobias from BSN 11 and today I'll be return demonstrating the assessment of the vital signs. So let's measure or assess first the body temperature of the client. For the preparation, we have to assess for clinical signs of fever and hypothermia, the site most appropriate for measurement and factors that may alter body core temperature of the client. So next, we have to assemble the needed equipments, and in this procedure, we need a thermometer, an alcohol. We also need an alcohol cotton swab for cleaning the thermometer before and after use. So in this procedure, we'll also assess the client's respiratory rate while waiting for the temperature to beep or to complete the reading. So first, for the implementation, we have to introduce ourselves to the client, verify the client's identity, explain what you're going to do, why it is necessary, and how she can cooperate. So good day, ma'am. I am Shamel B. Tobias, a student nurse from Muslim University, Philippines, and today I am here to assess your vital signs. This includes your body temp, your respiratory rate, your pulse rate, as well as your blood pressure. So first, we'll be assessing your body temperature first. Okay, so for safety purposes, may I hold your hand as I check your ID band? Kindly tell me your name and age.
I'm Hannah, 18 years old.
Okay, so thank you, ma'am. So after that, we have to perform hand hygiene and observe other appropriate infection control procedure. And then we're going to provide for client's privacy by closing the curtain around the bed or closing the door of the room if possible. And then we're going to place the client to her appropriate position for the desired procedure. And in this procedure, the client can be in a position while the client is sitting. So now we're going to clean the thermometer. Before use, we have to clean it from bulk to stem, from cleanest to dirtiest. And then dispose this. And then we're gonna turn it on and put it on the client's armpit and wait for the thermometer to beep. So while waiting, I'm also counting the client's respiration rate without her knowing that, because that may alter the client's respiration rate, because she may get conscious breathing. So in this procedure, we'll just wait for the thermometer to beep. That indicates that the reading is complete. Okay. So we're going to read the temperature, and the client's body temperature is 36.5, which is normal for the axillary. So after use, we're going to clean it from stem to bulb. And then dispose this. And then rearrange the thermometer and place it on the storage location. And then after that, we're going to document the client's body temperature on the client's chart. So after that, we'll proceed to the apical radial pulse assessment. And the purpose or the preparation for this, we have to assess for clinical signs of hypovolemic shock. So first, we're going to assess the client's apical and then radial pulse for 60 seconds or 1 full minute. So first, we're going to assess the apical pulse, ma'am. And then, I'm gonna insert this here. the client's apical pulse is 72, which is just within the normal range. And I located the apical pulse, left midclavicular, fifth intercostal space. And now we're gonna locate and then count the number of pulse on the radial artery of the client. So allow me to hold you, ma'am. Thank you, ma'am. So the client's radial pulse is 70, which is just within the normal range for the radial pulse, and there is no significant pulse deficit that may indicate cardiovascular disease. So after that, we're going to document the client's findings on the client's record, and then we're going to proceed to the respiration. And as I have said earlier, I already conducted the respiration rate assessment. And allow me to just recite the preparation for the assessment. We have to assess the skin and mucous membrane color, position assumed for breathing of the client, the signs of cerebral anoxia, any chest movements, activity tolerance, chest pain, dyspnea, and medications affecting the client's respiratory rate. So according to my findings earlier, the client's respiratory rate is 15, which is within the normal range of 12 to 20 breaths per minute in an adult. So after that, we're going to document that on the client's record, and then we're going to proceed to the assessment of the blood pressure of the client. And for the preparation, we have to assess for any signs and symptoms of hypertension and hypotension, and factors affecting the client's blood pressure and client's allergy to latex cuff. And for the procedure, we have to introduce ourselves, verify the client's identity, and after that, we're going to perform hand hygiene again. And then we're going to provide for client's privacy before and after the procedure. And then we're going to locate the brachial artery to assess the client's blood pressure and then conduct the blood pressure assessment. So I'm going to measure your blood pressure now, ma'am. Kindly move towards the table. Okay, so we're going to expose the upper arm of the client. So may I know, ma'am, what's your usual BP? Do you already know?
Yes, 100 over 70.
70. 100 over 70. So we'll just raise up to 80 millimeters. 80 millimeters of mercury. Okay, sir, your BP, ma'am, is 100 over 70 like your usual, and I think that is a little bit low for your age. So we're going to remove and then clean it with an approved disinfectant. And if this is your client's initial assessment, you have to perform it on the client's other arm. And if you don't have a stethoscope with you at the moment, you have to perform the palpatory method for assessing the client's blood pressure. So after that, we're going to document the client's blood pressure and the client's record and report pertinent data to the client's chart. So after that, that concludes the assessment of the vital signs. Thank you.